Good morning, everyone. It's October the 27th here in the Seminole County Emergency Operations Center, right at 10:30 morning. I'm sorry.
You said October. It's March.
I'm sorry, March 27th. It's been a very, very busy couple weeks. So March 27th, 10:30 in the morning here at the Seminole County EOC. I wanted to give you an update on, of course, COVID-19 and then answer questions as they come in. I appreciate you all watching over the last few weeks. We've been doing this update every Tuesday and Friday at 10:30. We're going to continue to do that to provide good information to you. We will have a press conference this afternoon. The press conference this afternoon at 2 p.m. is related to schools. So we will have Seminole County Public Schools and Seminole State College at that press conference at 2 p.m. to talk about online schooling and those types of pieces of information. I want to give you an update on COVID-19 here in Seminole County. We currently have 43 cases of positive COVID-19 in the county. 3 of those are from non-residents, so those are people that have traveled here. They were visiting with family, and then they kind of got stuck here getting symptoms, and then of course coming down with COVID-19. And then 40 of our Seminole County residents have COVID-19. And there's quite a few folks, of course, in isolation and quarantine, and that could be related to them traveling overseas and coming back. Some of those are coming off of the quarantine and isolation, actually 43. So ironically, the same exact number. So 43 people have come off of isolation and quarantine. That means they traveled to another country. They came back, they were placed on isolation and quarantine, and now they have tested negative for COVID-19. So they are able to do anything that any of us can do. Right now, they are not on isolation and quarantine anymore. The remaining individuals that are on isolation and quarantine, of course, we're providing wraparound services for those individuals. That's food, delivering pharmaceuticals if they need, heart medication, insulin, whatever they may need, to their houses so that they can stay isolated in quarantine. The services we provide are strictly for those individuals that are required to stay at their home. We have had a few calls of people that are self-isolating, so they have taken it upon themselves to shelter in place at their home. The wraparound services is not for those individuals. It is for people that have COVID-19 or were told by the Florida Department of Health because of symptomology or because of travel that they needed to isolation and quarantine in their home. So the Florida Department of Health had to have said that, or the hospital where they're getting tested, they had to have said that for us to provide the services. And we have provided a lot of information to those. So those individuals are getting called daily. I want to give you an update on personal protective equipment. We've had some supplies coming in for personal protective equipment. We've been able to provide assisted living facilities and nursing homes and our local hospitals and standalone emergency rooms. The personal protective equipment that they need, that's gowns, N95 masks, the respirators, things like that, to make sure that all of those individuals are taken care of. We classify their needs based on how long they will have supplies. If it's a critical need, they may be running out within 48 hours, and of course we expedite requests from the state and the federal government to get those shipments in and then move it over to the facilities. We've been able to service 38 facilities that were in the critical situation. That means that they would have run out in 48 hours. None of those did run out in 48 hours, so all of those now have supplies there. Again, wraparound services are being provided to a little over 200 people in isolation and quarantine. That's the food services, the pharmaceuticals, things like that. The regional testing site was open just recently. So the regional testing site is at the Orange County Convention Center, and this is for individuals that are 65 years and older that are having symptomology, so they can go down to the Orange County Convention Center. We would love to have a drive-through clinic for all counties in the state of Florida. That just is not staffing-wise, testing-wise, it's just not possible at this time. So they've established these regional sites. So the regional site for Seminole, Osceola, Orange, Lake, in Brevard County as at the Orange County Convention Center. Again, they're testing people that are 65 and older that have symptoms. They're also testing individuals from the healthcare field and first response, no matter what. So you don't have to have symptomology. We did hear yesterday that the line was moving quite rapidly, and there was no wait in the line. So that was good to hear. And the line moved very, very smoothly. They tested quite a few folks. The first day, 247. 81 people, though, were turned away. So that's people that showed up and just wanted a test, but they didn't have any symptoms. We would love to just be able to do that, but there's just not enough test kits out there just to test randomly anyone that wants to get tested. It needs to be someone that is vulnerable, so 65 and older, and they have tests. They need a test. There's a question here about the stay in order. Are we going to issue a stay in order, shelter in place type of order? So let me talk about that a little bit. I know that's been kind of a hot topic, certainly a topic for our press conference yesterday. So let me briefly talk about the orders in the other counties and how we came to make our decision here in Seminole County. So we looked at the orders from Orange, Osceola, Hillsborough, and Pinellas counties. And we looked at what they listed as essential and non-essential businesses. Essential businesses, they had a very, very long list, and I encourage you, it's very easy to find the list online, so you can go online, but they had a long, long list of essential services. Bike sales was an essential service. Boat sales and marine supply stores were essential services. A golf course was essential service. So a lot of different organizations were on the essential services list for those counties. So we looked at the non-essential services. So if we ordered something like this, who would actually be closing? Okay, so here are the list of the services. So and again, every county has to make a different decision. They make a different decisions because of different circumstances in their counties. Orange County is vastly different than Seminole County. They have lots of theme parks. They have to tell people, like the Fun Spot and the Gatorland and all the little amusement parks and theme parks that they need to close. So we looked at the attractions here in Seminole County. Central Florida Zoo, closed. Wekiva Island, closed. State Parks, closed. Black Hammock, closed. So a lot of those are already closed. So we looked at the next non-essential services listed in their orders. And the next non-essential services were bowling alleys. Airport lanes, closed. AMF lanes, closed. Oviedo Bowling Center, closed. So then we looked at the next category of non-essential services that they had in their orders, and that was movie theaters. AMC, closed. Amstar, closed. Regal, closed. Picture Show in Altamont Springs, closed. So then we looked at social clubs and fraternal organizations. So that was also listed as a non-essential service in those different orders there in Hillsborough, Orange, Osceola, and Pinellas County. And every single one was closed. All of the museums in Seminole County, closed. Shopping malls, all of the malls were, well, Altamont Mall is closed. Oviedo Mall is open, but only has 10 stores open, one of those being a Dollar Tree. And I don't want you to all run out right now and get this, but that particular Dollar Tree, I made a phone call out there to see what their openings were and stuff. They happened to have some paper towels, and I actually needed some, so I stopped by there on the way home and I got some paper towels. So I don't know that we want to close a mall that has a Dollar Tree in it that's actually serving the public and has cleaner and stuff like that. And we looked at the stores that were in that mall, and all of those were what were deemed essential in the orders of the other counties. And then Seminole Town Center, we also spoke to them. They have 12 stores that remain open. Most of those are curbside, so that you call in, you make an appointment, or you buy the thing online. They open their gate, they hand you the item, and then you move along. So that is why we made the decision to close things, or not issue a shelter-in-place order. If we do issue a shelter-in-place order, it will certainly close a lot of things. It will not be what we've seen in the other counties. So it's going to close a lot more things. But what we've seen from the order, there's no reason to issue a shelter-in-place order if everything that we would have ordered closed is already closed. That doesn't make any sense. So we will continue to look at that. Yeah, I see someone put liquor stores. So we did see that liquor stores were one of those. So yeah. So let's see. I want to give you our Citizens Hotline number, 407-665-0000. Again, 407-665-0000. They have individuals in there from the Florida Department of Health and Emergency Management. It's staffed Monday through Sunday from 8 to 5 to answer questions related to COVID-19. Let me go back to shelter in place one more time. And I just want to make sure that everybody understands it is not off the table. If we have to issue a shelter-in-place order, we will issue it. It will be most likely for many, many more business types than those of the other counties. What we saw from those other orders, if we had just mimicked the other orders, it would have absolutely done nothing in this county because every one of those businesses were already closed. We called every one of what we call non-essential businesses. So it isn't off the table. We discuss it every day. We had a meeting this morning to discuss it. We will have a meeting tomorrow to discuss it. So we will continue to discuss that. So if we need to, we will place that order and we will continue to do that. Let's see, some other questions. Let's see, many. I want to talk about our website. So prepareseminole.org, of course, it's got a lot of good information on it, information from all the municipalities. Over the last couple days, we did hear about a few folks that were congregating at basketball courts and things like that. So all the rims of the basketball courts were taken down, so that should not occur anymore. We did hear about some yoga classes and boot camps because the gyms were closed. They decided that they would move and congregate a whole bunch of people in a park. We stopped that from occurring as well, working with the individuals that were putting on that class. Again, trying not to issue a law, but certainly trying to educate. And that's really what Orange County said in their press conference anyways. They're not arresting anyone for this. They're trying to educate, and we want to educate. We don't want to lock someone up and send them to the jail, you know. The schools are continuing to prepare for their online schooling, which will occur on next week. So again, the press conference today at 2 o'clock will have information on that. Seminole State College has already started that, and Seminole State College will also be at the press conference today to discuss that. Testing sites. So there has been some questions about who's testing, where can I get a test, things like that. All of the hospitals, and I'm looking at the list right now over here, all of the hospitals in Seminole County are testing. All of the standalone emergency rooms now in Seminole County are testing. CentraCares are testing, and First Choice Urgent Care in Oviedo is testing, and the Urgent Care of Longwood is also testing. You need to have symptomology to test. It's kind of like if you, during flu season, if you go to the doctor and the doctor says, yeah, you don't need a flu test because your symptoms aren't related to that. It's the same thing for this. So if you come in and the symptoms don't match COVID-19, most likely they're not going to give you a test for COVID-19. They're going to try to figure out what's wrong with you. So I know that we hear COVID-19, COVID-19, COVID-19 on the news, and we see it on the TV, and we turn it on the web, and we go to social media, and everything's COVID-19. So everybody thinks they have COVID-19. Well, it may not. In fact, one of our individuals in here, someone had commented on my last Facebook Live, who's the guy coughing in the back? He has allergies. It's a real bad time now in Central Florida with the pollen. So you know, he's coughing, and he went to the doctor, even got a doctor's note that said, yeah, he's got allergies. He's on allergy medicine. So yeah, that's you know, that's going to happen, unfortunately. So if you present to a doctor, or you present to CentraCare or one of these urgent care clinics or something like that, and they decide that maybe that what you have is not the symptomology that is for testing, and maybe you have something else, then you know, for me, I'm going to follow whatever my doctor's advice is. So Everyone, unfortunately, can't get a test, but that's because sometimes people don't need a test. We have heard of individuals that coming in with the sniffles, and they say, I need a COVID-19 test. Well, that's not one of the symptomologies, so they may not. Let's see. Do you think schools will stay closed and continue distance learning again today at 2 o'clock? I know that they have plans to continue if they have to continue, but right now the plan is for schools to get back in on April the 15th. There's some questions about daycares. So daycares do remain open. In Orange, Osceola, Pinellas, Hillsborough, and Seminole County, the orders did not close daycares at any of the, even the shelter-in-place counties. Daycares are open. I know that daycares have set up additional security screening. They have many of them are doing temperature checks in the beginning, before the child even goes in. And I know quite a few of them will not let the parents pass the front lobby. So you drop off your child, they do the hand sanitizer, and then they go to the back. And we talk about all these things that need to be done, and it's just important for us individually to do the right thing, right? So as I mentioned, I go to Publix every once in a while and to get groceries, and I went to Publix the other day, and I went and shopped, and I did exactly what I'm normally do in the grocery store. Trying to I don't really keep my distance from people. I do keep my distance from people, and I get my items. It's common surface there, even though they washed it down the sill. A common surface of that shopping cart. So I went into the line. I did notice that when I got up to the line, everybody's kind of bunched up. So I tried to position my cart so I'm a little further away from the person in front of me. And then when I got up into the line, I started spacing out my food products so the person behind me wasn't right up on me. They kind of looked at me weird, but that's okay. I'm trying to social distance the way that I can. Once I got home, washed my hands, 20 seconds, singing happy birthday twice, going out and cleaning the surfaces, again, the steering wheel, the door handle. So just making sure that, I'm keeping good care, and that I'm caring for myself. When I go to the gas station, everybody grabs that gas handle. I even see someone about the gas handle. Jennifer, thank you. But the gas handle, everybody touches that thing, right? So it's funny, I think about those things now. Now when I'm driving home, I'm like, oh, I touch that gas handle. I can't touch my face, can't touch my face, can't touch my face. And then when I get home, I pull in, wash my hands, clean the steering wheel, those types of things. See some things about salons. We have heard of a lot of salons closing down, and the ones that have, I know that remained open. We haven't heard of any that aren't, that a lot of people are congregating at or anything like that. If we do, of course, we're going to reach out to that particular individual, that owner, and provide CDC guidance and public education to those individuals. I know that there have been a couple that have spaced out their chairs, so you can't be right next to the person. Used to be, right person, but that is not the case in most of those that we've heard of. And once that we've heard any issues whatsoever, we give them a call, and the owner's like, absolutely, you're right, let's go ahead and do that. What we have seen, unfortunately, in other counties where now shelter place is ordered, is people going home, and now they're doing it right out of their home. So is it safer in a salon where you're actually doing some cleaning services, or is it safe in the person's house? I don't know, and unfortunately that's what's happening. So that's something that we have to look at as well. Do we issue a shelter-in-place order, and if we do we close down all the hair salons and those types of places in the county? So we're gonna look at that, and each day we look at that. Playgrounds. So someone asked about playgrounds. So all of Seminole County's playgrounds are closed. Again, trying to follow the CDC guidelines, trying to follow good public education. We have closed all of our playgrounds. We have those that that we cannot close because there's not gates directly around the playground. We didn't want to close the entire park, so we put signage up all around those that don't get on the equipment, things like that. We tried to at least leave the rest of the park open because we don't want to close an entire park just because of a playground. So we have tried to leave those open because sometimes people like to walk their dogs and maybe throw a frisbee or something like that. So in that case, then they could go ahead and do that as well. So ERs and hospitals. So yeah, there's some questions about ERs and hospitals. Hospitals and ERs are doing some testing. So again, what we ask is that you call ahead and let them know that you're coming, tell them your symptomology, and then you know, we want to protect our nurses, we want to protect our doctors and things like that. So just make sure that you call ahead, let them know that you're going to be coming there so that they can wear the appropriate personal protective equipment for that. So so a lot of questions about, is there going to be a shelter-in-place order? Is there going to be a shelter-in-place order? Absolutely, it is not off the table. It is not off the table. If it is a shelter-in-place order, we're going to do it right. Not that the other counties didn't do it right. You know, they did what they needed to do at this particular time. Their shelter-in-place orders, if you read it, and I encourage you, go online, read their shelter-in-place orders. The non-essential services that they have closed down, most all of ours, and we've called every bowling alley, we've called every movie theater, we've called every pool, all of those are closed. So we would issue a law that says that you got to close what you've already closed. The other ones that are open, that remain open, a couple stores are heeding the CDC guidelines. There are less than 10 people allowed in the store at any time, 6 feet distance from the person in front of you. So that's if we issue a shelter-in-place order, it certainly is going to be for more than what we've seen. But at this particular point, if we had issued the exact same shelter-in-place order as the other counties, it really would have had almost zero effect in this county whatsoever. So, where do homeless stay? So that is a good question. So we have a plan for our homeless population. The plan is related to if someone gets sick. So if someone gets sick, we have a location where those individuals will be isolated from, they won't be put in a large group. They will be isolated. They will be taken care of. And same thing for the substance abuse. So there's some rehab centers and things like that. So we were working with the substance abuse and rehab centers here in Seminole County to make sure that they are okay, that they have the proper cleaning and proper care for the individuals that are in their care. And then if anyone does get sick at one of those facilities, then we move those individuals to a location where we have identified for some isolation and quarantine for those individuals we want to take care of them. Thank you. If you do, one of the questions was about if you see a large group, what can you do? Please call our non-emergency line for the Seminole County Sheriff's Office, 407-665-6650. Again, 407-665-6650. We want to know if there's any groups or gatherings or things like that. You know, according to the Sheriff's Office reports, calls for service is down 16%. On our fire rescue, we've had a major decrease in calls, major decrease in traffic collisions, which means that there's less people on the road. We have a 40% decrease in crime because people are just not out as much. So people are heeding the warnings. But again, we do know that, you know, it doesn't even matter. It could be, you know, other counties even have the shelter-in-place order. Some people are just not going to listen. Some people are not going to follow guidance, and some people are going to throw COVID parties or whatever they're going to do. And if they do, if you have a party down the road or you see a large gathering of people, we want you to call the non-emergency line for the Seminole County Sheriff's Office so we can go out. It's 407-665-6650. Again, 407-665-6650. So I see some things about the nurses. Yes, please. There's a couple heroes. I mean, there's a lot of heroes in this, but the one group of heroes is certainly our nurses. We want to protect our nurses. We want to protect our healthcare people out there. They're such an essential service. They're so needed in this community. So we want you to, if you have symptoms of COVID-19, again, the symptoms are coughing, shortness of breath, and fever. So if you have those symptoms and you want to get a COVID-19 test, please call ahead, protect our nurses, and protect our healthcare staff. The second heroes is our grocery store workers, right? They continue to have to work. And probably the largest congregation of people right now, certainly that I've seen, and I've driven all over this county, is in grocery stores. So we want to protect them as well. We want to thank them because they are continuing to stock the shelves. They're continuing to check us out and provide us our food services and things like that. So we definitely want to thank them for those services. Seeing what other questions we have here. I see some people upset, and then I see some people that are happy about. So we get it. Some people are going to be happy about what we've done so far and not having to issue a law, and some people are going to be angry. I get it. It's a hard decision, and we looked at the other laws, the other executive orders in the other communities, and we just said if we're going to do something, we need to do something with more. The things that were done in the other communities are great for those communities, but our businesses are already complying with that. So why would we issue a law for businesses that are already complying with what we are doing as far as guidance? So Sarah's asking a question about hospital supplies. So the hospitals are being supplied with N95 masks, gowns, gloves, eye protection, things like that. They have been in contact with us as well as the assisted living facilities and nursing homes and things like that. So we are working with them on that. We have been providing them with those types of services and the personal protective equipment that they need. So far, we've been able to prevent any of the hospitals and medical centers from running out or running low of any personal protective equipment. We hope to continue to do that. Of course, we are relying on the state and the federal government to send those supplies, just like it's hard for you to get supplies. If you go, you can't find any, in some places, toilet paper, but hand sanitizers and things like that. We're having a hard time also supply and demand with personal protective equipment, so we are trying to do our best to get the personal protective equipment to those in need. Let's see. How can we keep our children and families safe? So great question. Again, hand washing, common surfaces. So avoid the common surfaces if you can. Staying social distancing. We can shelter in place. So we can all shelter in place. We don't have to have a law to do it. We can just do it. So we can shelter in place. When we go home, don't go out and get with large groups of people. You can still walk around the block. You can still do outdoor activities, throw the frisbee or whatever, but don't get in large groups of people. If you do have to go to the store, the hardware store, the grocery store, or whatever, common surfaces, just be careful of those. Wipe those down if you can. If you can't, when you get back home, hand washing. Hand washing does an incredible thing. If you're not feeling very well, don't leave. One other thing is, when I was in the grocery store yesterday, I saw entire families that have gone into the grocery store. Minimize that. You don't have to bring the entire family. If there's any way for you to not bring the entire family in, let's not do that. If one person can go in and buy all the food, then maybe that's the way to go. So that's just something to think about. It's just try to protect. So yeah, Carol says pool companies. Yeah, pool companies in the other counties is considered an essential service. Bike sales is. Golf courses are essential services, so they still have to go to work. Marine sales, boats, sailing on boats and boat equipment. If you sell anchors and compasses and things like that for a boat salesman, then yeah, you have to go to work in Orange County. You have to go to work in Osceola County because those are essential services. So if we do an order, we're going to look at what is really an essential service and what is really not an essential service. So we're going to look at that. There's a question about some procedures that have been canceled. So yes, some procedures have been canceled. Some surgeries and things like that have been canceled. And most of those have been canceled due to the need for personal protective equipment for the entire country, right? They're running out of personal protective equipment in New York. Thank God we're not at that particular spot here in the state of Florida, but they've decreased some of the surgeries because and other procedures because they want to make sure that there's personal protective equipment for other individuals. So the people that, and I'm not just talking about COVID-19 cases, the more critical type of cases too, whether it's open heart surgery or those types of other critical types of surgeries. So just know that. I know we are at 11. I'm sorry I couldn't get to all the questions. At 2 o'clock again today, there's a press conference, and that'll be related to schools. So Seminole County Public Schools and Seminole State College. I want to give you our website again, prepareseminole.org. Prepareseminole.org has a lot of great information on it, everything that you could want for the city. From the city information, all of our cities' informations are on there, as well as all of the county closures and things like that. And then also our telephone number, 407-665-0000. Again, 407-665-0000. And that's for the COVID-19 hotline, so they can answer questions related to COVID-19. Where can you get a test? What are the symptomologies? Those are being answered by Florida Department of Health as well as emergency management personnel. Thank you again for listening. I hope you have a wonderful day. Stay healthy and safe.